Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Schizophrenia spectrum disorders present a complex array of symptoms that have been recognized and studied for centuries. Originating with Eugen Bleuler's characterization in the early 20th century, our understanding of these disorders has evolved significantly. Today, they encompass a range of positive, negative, cognitive, and affective symptoms, impacting individuals in various ways. Treatment typically involves a combination of medication, psychotherapy, and support services tailored to each person's needs. While prevention strategies are limited, early identification, supportive environments, education, and ongoing research play key roles in managing these disorders effectively. History of schizophrenia spectrum disorders. Schizophrenia spectrum disorders have a complex and varied history, with references to symptoms resembling schizophrenia dating back centuries in different cultures. However, it wasn't until the late 19th and early 20th centuries that schizophrenia began to be formally recognized and studied as a distinct psychiatric condition. In 1911, Swiss psychiatrist Eugen Bleuler coined the term schizophrenia, which means split mind in Greek, to describe a group of symptoms characterized by disorganized thinking, hallucinations, delusions, and impaired social functioning. Bleuler's work helped to shift the understanding of schizophrenia from a unitary disease to a spectrum of related disorders with diverse symptoms and outcomes. Since then, research into the neurobiological, genetic, and environmental factors contributing to schizophrenia spectrum disorders has expanded, leading to advancements in diagnosis, treatment, and support services. Despite these advancements, schizophrenia remains a complex and challenging condition to manage, highlighting the ongoing need for research and intervention. Symptoms of schizophrenia spectrum disorders. Schizophrenia spectrum disorders encompass a range of symptoms that can vary in severity and presentation, but typically include positive symptoms. These symptoms involve distortions of normal functioning and include hallucinations, perceiving things that aren't real, such as hearing voices, delusions, false beliefs that persist despite evidence to the contrary, disorganized thinking, difficulty organizing thoughts or making logical connections, and disorganized speech, incoherent or nonsensical speech patterns. Negative symptoms. Negative symptoms involve disruptions to normal emotional and behavioral processes and may include reduced emotional expression, flat affect, social withdrawal or isolation, diminished motivation or pleasure in activities, anhedonia, and reduced speech output, alogia. Cognitive symptoms. Cognitive symptoms of schizophrenia spectrum disorders may include difficulties with attention, memory, and executive functioning, leading to problems with decision-making, planning, and problem-solving. Affective symptoms. Some individuals with schizophrenia spectrum disorders may experience mood symptoms such as depression or anxiety, which can further complicate diagnosis and treatment. These symptoms typically emerge in late adolescence or early adulthood and can persist over time, fluctuating in intensity and severity. Treatments for schizophrenia spectrum disorders. Schizophrenia spectrum disorders are often treated with a combination of medication, psychotherapy, and supportive services tailored to the individual's needs. Common treatments include antipsychotic medications. Antipsychotic medications, such as first-generation typical and second-generation atypical antipsychotics, are commonly used to alleviate positive symptoms of schizophrenia by blocking dopamine receptors in the brain. Psychosocial interventions, psychotherapy, including cognitive behavioral therapy, CBT, supportive therapy, and social skills training, can help individuals manage symptoms, improve coping skills, and enhance social functioning. Family education and support, involving family members in treatment, can provide valuable support and education about schizophrenia, improve communication, and reduce family stress. Rehabilitation services, vocational rehabilitation, housing assistance, and community support services can help individuals with schizophrenia spectrum disorders improve their quality of life, maintain independence, and integrate into their communities. Hospitalization and crisis intervention. In cases of severe symptoms or acute exacerbations, hospitalization may be necessary to ensure safety and stabilization, with a focus on crisis intervention and symptom management. Prevention of schizophrenia spectrum disorders. While the exact causes of schizophrenia spectrum disorders are not fully understood, Certain factors may increase the risk, including genetic predisposition, prenatal exposures, early childhood trauma, and substance abuse. While it may not be possible to prevent schizophrenia spectrum disorders entirely, early intervention and targeted strategies may help reduce the risk or minimize the impact. Early identification and intervention. Recognizing and addressing symptoms of schizophrenia spectrum disorders early can lead to better outcomes and reduce the risk of long-term disability. Supportive environments. Creating supportive environments that promote mental health and well-being, including access to quality health care, education, employment opportunities, and social support networks may help mitigate risk factors for schizophrenia spectrum disorders. Education and awareness. Increasing public awareness and understanding of schizophrenia spectrum disorders, reducing stigma, and promoting early intervention and access to treatment can help improve outcomes and reduce the burden of the condition on individuals and society. Research and innovation. Continued research into the underlying causes, risk factors, and treatment approaches for schizophrenia spectrum disorders is crucial for developing more effective prevention and intervention strategies. By understanding the history, symptoms, treatments, and prevention strategies for schizophrenia spectrum disorders, individuals, families, and communities can work together to support those affected by these complex conditions and promote mental health and well-being for all.